This is the Dental Up Podcast, brought to you by Keating Dental Arts, a full-service, award-winning dental laboratory. Each week, you'll learn tips and techniques from real-world dentists, bringing you in-depth interviews, motivating stories, current events, and sports.
Here is your special host, the Senior Technical Advisor for Keating Dental Arts, Brandon Fetters.
Hey everybody, Brandon here. Welcome to another episode of the Dental Up Podcast. Today we're going to be going over digital dentures, the materials to make them, as well as the processes done here in the laboratory. With us today, we have a special guest, Mr. Jim McEachern, CDT. Jim has a lot of knowledge, comes from a background in Navy training in dental technology, and he's also the manager of the removal department here at Keating Dental Arts. So without further ado, let's go ahead and jump right into it. Could you please describe to us what are digital dentures?
The term digital denture is just used to describe the entire workflow involved in the fabrication of a CAD/CAM milled or printed denture. The process is made of innovative devices, software, and materials suited for both dentists and dental laboratory technicians.
Beautiful. Now, how did the digital dentures actually differ from original traditional processes of making dentures?
Well, the denture base of the upper denture covers the palate, and the lower denture is a horseshoe shape to accommodate the tongue. The newer digital dentures are milled out of a solid block of preferably cured very hard resin, which doesn't distort as it cures like the conventional dentures do over a period of time.
So really, it's quite a bit more accurate. Then you're not having that shrinkage factor, or so would you say, from the curing process?
Exactly. The digital block that it's milled from is already cured, and the shrinkage is already taken place. The printed denture too, as well. There's no stress. It is printed, and it results in a much denser, finer denture, better fitting denture than the traditional denture that we commonly see today.
Very nice. Now, what kind of benefits are going to be seen by doctors and patients?
Well, the digital denture impression takes less time than the conventional impression, so you don't have to spend as much time for the patient in the chair and, of course, doctor's patient time. Patients benefit from the dental technology. It allows a dentist to take accurate pictures of their teeth, gums, and jaws in less time.
Awesome. And then, like you were mentioning about the shrinkage, I imagine that the fit is superior with the digital dentures. Is that right?
The denture base itself, it fits much better. It's more accurate. It's more precise. And again, the digital denture process, the most important thing is less chair time, less time without edentulous areas in the patient's mouth, because it can be fabricated much quicker and more accurately.
Very nice. Now, what about, you mentioned the cured material used for the block when that's being milled. What other materials are we using here to get those made at Keating Dental Arts?
At Keating Dental Arts, we are currently printing the denture base. The denture material is made of a high impact color material. It's a flesh-colored material. It's got 1,200 megapascals strength. In other words, it's very, very tough. It's very flexible. This is the type of denture that doesn't require any necessary repairs, even though it does and can be repaired in the future.
Gotcha. Now, what about the denture teeth that are being used? Are those different than previous or other types of denture teeth?
Yeah, the denture teeth used today, there are numerous types of teeth, and they range from the inexpensive teeth that are bought in South America to the more expensive teeth that are fabricated here in the United States. At Keating Dental Arts, we use the best of the teeth that are produced in the United States, and this is by Dent Supply Sirona. They're called IPN teeth. They have a better wear resistant. They're more color stable, and it just produces a finer product and a much more aesthetic and more pleasing denture than the typical denture.
Great. Now, you mentioned about the wear. What type of wear would we be seeing with this? Are they stronger than traditional dentures in that regard?
They're probably equally as strong. However, the wear resistance is much better in the sense that they're not as brittle. They're not apt to chip. They're not apt to discolor. and it's actually closer to the natural dentition that you would have in your mouth.
Gotcha. And can you give us kind of a brief synopsis as to the process of a digital denture case?
Well, traditionally, a regular denture, you would go in for a analog type impression. You would mix impression material. You would take an impression. They would be sent to the laboratory. The laboratory then would fabricate what we call a record-base base plate bite rim. Upon the doctor receiving that, he would get the vertical dimension, the midline, and the smile line on the denture. We would then set denture teeth up accordingly, return it to him for a try-in. With a digital denture, the doctor can intraorally scan the mucosa, upper and lower, take a vertical registration, and then sent to the laboratory, and this can be placed on the computer. Aligning certain anatomical landmarks, the two arches then could be mounted according to the vertical registration that we have.
That's great. No, sorry, were you about to say something?
Yes, I was going to say this process saves the patient time and the patient-doctor time. This only requires that we take impressions and we have a vertical, and we can return it for an immediate try-in for phonetics and aesthetics. The conventional denture, you have to have that one step, which is the bite registration. We can eliminate the bite registration simply going, which saves the patient time and saves the doctor's time.
Gotcha. Now, you had mentioned immediate there. It made me wonder, are we going to be able to do that process with immediate dentures for extractions and then a try-in placement?
Yeah, there should be no problem whatsoever with immediate dentures. We also, with this particular process, the digital denture, there is what they have as a trial denture. You can actually fabricate a denture. The maybe disadvantage is that it's all out of one tooth color. A lighter shade, and the denture tooth itself, as well as the denture base, is one kind of monotone color. The advantage is that right away we can print it up. If the aesthetics are wrong and the patient wants to do some characterization on these teeth, it can be done right there at chairside. If it doesn't fit, it doesn't work, there's no expense. We can just discard it and actually start all over again.
Now, doing this whole digital process in the laboratory and printing the bases, are you going to find that it's going to speed up the return rate of these cases, the turnaround time?
The turnaround time will be much quicker simply because there's not so many processes involved, and those processes are primary with processing the old denture base, curing the denture base, pouring up your stone cast, allowing them to set, articulating the case. This can all be done on the computer, which of course is going to save a tremendous amount of time. Again, time is the most precious thing, not only to the patient, but also to the doctor.
Excellent. Yeah, and also eliminating a lot of expansion and contraction and all those steps that you just mentioned. Now you had mentioned about the milling of the denture base. Can that be relined as well?
Yeah, the denture itself, the material can be relined, and it can also be repaired. I don't suspect, though, with a strength of 1,200 megapascals, this denture will be breaking unless you take a hammer to it or a sledgehammer and break it. The traditional denture right now, sometimes if the patient during the cleaning process drops it in the sink, you can break a denture tooth or part of the denture base itself. This material is almost virtually unbreakable.
All right, awesome. So, Jim, can you share with our listeners where they can go to learn more about this product?
Sure. They just need to go to keatingdentalarts.com.
Well, Jim, I really appreciate you taking your time out of your busy day. I know you're a very busy man. So thanks for sitting down with us and sharing the information about digital dentures. Really appreciate it.
Thank you.
You got it, man. Take care.
Thanks for joining us on the Dental Up Podcast Show this week. Make sure to follow us on Facebook, Instagram, and Twitter, or search the Dental Up Podcast on iTunes for our weekly feed. Don't forget to visit keatingdentalarts.com/promo for exclusive offers. Keating Dental Arts is a full-service dental laboratory, and we're nationwide. We'd love for you to send us a case so we can show you the Keating difference. If you dig what you heard, please leave a review on iTunes, and we'll be back next week.